and some of your cosmetics that you have in your clinics, it's written there oligopeptides, and these are actually synthetic growth factors. The ones here is actually recombinant DNA growth factors. It means they are human growth factors which they have cultured in particular medium, with E. coli in particular medium, and it is similar to what the growth factors that we have in our body. Okay, so just switch over. So, we're just talking about growth factors in general. So the overview for today is what are growth factors and how it actually helps to reverse the aging process. So growth factors are actually proteins that binds to receptors in the cell membrane, and then what growth factors does is it activates or it inhibits certain processes. So for certain repair processes, it either activates the repair process or it inhibits the repair process. So there are a lot of different types of growth factors, but the ones that we are very interested in are actually growth factors which help with the skin. They actually help with the skin. So they are actually chemical messengers between cells. Just imagine them something like hormones. Without hormones, our body cannot function. Same thing, without growth factors, body cannot function as well. And there are a variety of cellular functions that switches off or switches on with growth factors. So if you can activate the proper growth factors, it increases the rate of cell turnover. And as well as it's involved in cell proliferation, with levels of growth, with platelets, etc. A lot of us are actually using growth factors without knowing it. First of all, like I mentioned, synthetic growth factors. Second of all, a lot of us are doing PRP. What is in PRP? PRP, even though it stands for platelet-rich plasma, the platelet part of the PRP is not useful. It's actually what happens after the PRP is injected. It starts a cascade of messengers. It promotes certain growth factors. And we know in PRP, if you read a little bit on PRP, you know that in PRP, when you activate the platelets, it actually produces a lot of different types of growth factors. So that's what we're actually doing with PRP. Alright, so these are the cytokines and growth factors which we are interested in, and they are the ones who help with our skin cell turnovers. It helps with melasma, it helps with blood vessel, capillary growth. For example, we have TGF beta, we have beta 1, 2, and 3. It stimulates collagen production, stimulates fibroblast collagenase, increases the fibronectin synthesis, inhibits matrix degradation, cell chemotaxis. Then the platelet-derived growth factor, and this is the part where when you're doing PRP, you have a lot of this one, the platelet-derived growth factor. It stimulates the fibroblast of collagen, stimulates angiogenesis, you have more capillaries. It helps with wound contraction. That was why PRP was created in the first place. PRP was actually first created by dentists to actually help with tooth extraction. They had certain abscesses that they cannot close properly, and then they created PRP back in the 60s. So this was the main function of PRP, it was to stimulate wound contraction. Then again facilitates cell chemotaxis. Now you have your granulocyte, monocyte colony stimulated effects. And this one improves your leukocyte function. That's why whenever you inject the PRP, you almost never get infection. You almost never get infections because of this particular growth factor, because of this leukocyte function. It activates your neutrophils, eosinophils, monocytes. It stimulates proliferation of your different hematopoietic cell line. Interleukins, IL-3, 6, 7, 8, these are the ones we are very interested in. It regulates your cell hemostasis, stimulates proliferation and differentiation of your hematopoietic cell lines. So now we know that we have, these are the growth factors that these are exact same growth factors in your PRP, when you do PRP. Now, the issue with PRP is we do not know which of these growth factors are being excreted. We're not sure whether they're excreting a lot of this and very little of this, or whether it's being excreted at all. So what if we gave you a way where we can remove the part of buying expensive PRP kits, we can remove the process whereby your results are not so consistent. Some patients get great results, some patients do not get such good results. What if we remove this process and we tell you, time and time again, we give you the exact same growth factors and you get the consistent results for every patient, no matter young, old, whatever chronic disease or any acute disease they have. So this is growth factor. It is a lock and key mechanism. So you have the key, which is your substrate, and you have the lock, which is the enzyme. With the correct key and the correct lock, that's when you activate or inhibit certain processes. Now, in the market, there are a lot of synthetic growth factors. What they do is, this particular substrate, they have added certain molecules to stabilize it. So when you actually apply these growth factors, it tries to fit in the lock. Sometimes it doesn't fit. It's because of the extra bonds that they've added. Some have added extra carbon bonds, some have added extra sulfate bonds. So because it sometimes it doesn't really fit. That's why some of the growth factors that you have in the market, topical growth factors, it works well for some of your clients. It doesn't work well for some of them. Now the ones we have here is exactly the same as human growth factors, the ones you already have naturally in the body. They have extracted it, so it will always fit. The lock and key mechanism will always fit. So, as we all know, the aging part of the skin, so it's actually an Ampersand process. So it's damaged by sun, damaged by pollutants, and the most obvious changes, of course, dryness of the skin, you start to have wrinkling, gynolepsy, and what growth factors can do is they can actually slowly reduce the aging process just by topical itself, without needing injections, just by topical itself. Alright, so this is the wound healing. So this is what we do with PRP. When you inject them with platelets, then it stimulates the neutrophils, macrophages, lymphocytes, fibroblasts, and then capillaries. Now, the one that excretes growth factors is the fibroblasts. The platelets don't do anything. Platelets actually start this cascade. So you can see, after injection of your platelets at 0 days, your fibroblast is only stimulated at earliest day 4. Majority of the time is 1 week. That's why with PRP, we always tell patients, you have to wait for your results to come out. You have to wait for results. Now, what they've done here is they've isolated the fibroblasts here. So from day 1 itself, you can see results after application of the growth factors. So dermal fibroblasts, they are actually the construction workers in the skin. They are actually the ones producing the collagen. And as we age, we lose about approximately 1% per year after the age of about 24. The rate of decline of fibroblasts increases with sun damage, with chemicals that we take, with damage to the skin, etc. So today, is there any problem with using too much growth factors? There are some studies which shows that excessive usage of growth factors inside the body internally, if you activate it intrinsically, yes, they might cause certain problems like breast CA, for example. There are research that shows that intrinsic epidermal growth factors activated inside the body will make the breast cancer worse, or will actually start the process of getting breast cancer. But what we're doing is, it does not go into the system, we give it topically. So there's no way for it to actually enter the bloodstream unless you accidentally injected it. That's why the growth factors that we're using here is just purely topical. It's purely topical. So to date, there are no negative effects of topically applied growth factors. And growth factors aren't actually found in the body. They don't enter the bloodstream, they cannot be recycled by the body, means the body cannot take the growth factors that we have applied, then use it for some other organs. You will never use it. And US FDA allows the usage of growth factors in cosmetics. So they are the most stringent, they are the most strict, and they have allowed the usage of growth factors in cosmetics. And you actually look through PubMed and all, you will find that there's easily over 500 articles published just purely on growth factors, topical growth factors. So what are the results it shows? 94% of women shows an improvement in overall appearance in their skin just by using topical growth factors. And this is just in 4 weeks. 85% experience improvement in skin texture, 79% in skin firmness, 87% saw reduction in appearance of fine lines and wrinkles. And this is just in about 4 weeks. Just through topical. We have a lot of different range of clients. Some clients, they want fast. They don't mind surgeries, or they don't mind minimally invasive Botox or fillers. But then there is a separate group of clients that doesn't want to do any injection, they just want creams. So this is actually another way for them to actually reduce, to actually have that anti-aging cosmetics without needing to go through minimally invasive procedures. So, sorry about this. So this is actually a study done in Korea in just last year, June 2014. And this was a study done for mild to moderate acne just by usage of growth factors. So what these doctors have done, they picked up, handpicked about 28 clients, 28 male clients. They did a half-face study for them. Half the face they used the regular products, half face they used purely topical epidermal growth factors. And they applied, and they reviewed them in 2 weeks, 4 weeks, 6 weeks, 8 weeks. And they found that at the end of 8 weeks, at the end of 2 months, they found that there is a marked reduction of acne and sebum excretion in the half of the face that has light epidermal growth factors compared to the other half that didn't apply. So in Korea, they are highly promoting usage of epidermal growth factors for acne. And I'm sure we have a lot of products for acne in the market. And you can actually use your epidermal growth factors on top of whatever you already have to actually enhance or speed up the process. The next one is the effect of epidermal growth factor containing cream on PIH after Q-switch laser. And this wavelength 532. A lot of us have Q-switch lasers. We're using this wavelength 532 or 1064. So what they've done is they have measured at day 0, day 3, day 7, and day 35. They did a Q-switch laser and they applied a layer of epidermal growth factor. They found out that after 7 days, there is no reduction in PIH when compared to their control group. But they noticed after 35 days, means after a month, they noticed that the group that has applied epidermal growth factor actually reported a higher reduction in pigmentation or in PIH compared to the control group that didn't apply it. Epidermal growth factor and growth factor signaling in laser-induced melanogenesis, CO2 lasers. CO2 lasers in some of our clients make the PIH worse. Some of the clients come in with CO2 laser after that. Maybe our laser technician accidentally used the wrong power, accidentally burned them, and they come and complain to you, in 2 weeks' time, I have this red patch here. Is there anything I can do about it? It's been proven that, and this one is tested on mice, that usage of EGF creams on top of laser, means post-laser, you finish a laser straight away, you put your EGF cream. It actually reduces the chances of PIH, minimizes the risk of PIH. And this was just recently done, again, December 2013. Protective factors of epidermal growth factors and fibroblast growth factors against ultraviolet rays and against human skin wrinkles. And they found that it can be, at the time, it was 2013, it can be a potentially therapeutic. It means that just usage of your epidermal growth factor creams itself is able to reduce wrinkles and as well as to reduce sun damage. Of course, what is recommended is you use your epidermal growth factors or your growth factor creams with whatever protocol we have. A lot of us are using retinol or base creams or even hydroquinone. You can top it up with that. And then you have your TGF Beta 1, which decreases melanin synthesis via extracellular activation. Well, what TGF Beta 1 does is very simple. In some of our clients, they have hyperactivity of their melanocytes. Means that their melanocytes are very active. That's why they get all this melasma easier than the counterparts. They might come in for very regular lasers, or they come in and purchase very regular creams. And you have probably in the first year you tackle their melasma problem. It goes off. Then year, 2 years time, it comes back again. Because what happens is the melanocytes are hyperactive. So what TGF Beta 1 does, it down-regulates the melanocytes. It deactivates the melanocytes. So it doesn't take all of them, it just reduces the activity of the majority of melanocytes so that you can prevent further occurrences of